Introduce instrument sharpening, and you're at a point in the semester where you've been using your instruments for several weeks now, and they've gone through the process of autoclaving repeatedly, and you've been utilizing them on one another. So what you're beginning to find is that your instruments are starting to dull. And instruments will dull via use or even just the autoclaving process. So it's that time where we're going to begin to think about sharpening. And so what I would need for supplies are obviously my instruments, the stone that I would be using, and in this case, this semester, you're going to be using your Arkansas stone, which is a natural stone. What that means is that when you lubricate this for use, you need to use oil. The stone that you will have in the cassette that you'll see in the spring is a ceramic stone, which is man-made, and lubrication for that is with water. So moving back to the Arkansas stone, this will be in your cassette. You would also have a test stick in your cassette. So that comes from underneath that test stick clip. You would take that out and you would use that as part of your supplies. You would have your light overhead. You would have your sharpening oil in the drawer that you're sanitizing and disinfecting every time you're setting up your patient treatment supplies. And you would have your air water syringe and gauze as part of your supply. So what I would do first is begin to lubricate my stone. So I would go into the drawer with a combination of patient treatments and overgloves. I would open my drawer and take out my sharpening oil. The reason that I'm picking this up with patient treatments and overs is because it is in the drawer. I don't want to contaminate it because it has a very ribbed top on it, and in order to disinfect that would be very difficult. So I want to make sure that I'm handling it with patient treatments and overs and not contaminated patient treatment gloves. I would unscrew the cap, and staying above the stone, I would drop approximately 10 drops of oil onto the stone. I would then secure the cap tightly, put it back into the drawer, and remove my overgloves, leaving them in the drawer. What I would then do is take one of the sterile pieces of gauze in the cassette, and I would rub the oil over the entire stone, front, back, sides, and top, thoroughly lubricating that stone. If your stone is new or it has been sitting for a period of time, it will dry out even more. You might need more than 10 drops of oil initially in that particular case in order to thoroughly lubricate that stone. So you would have to assess that on an individual basis, and if you needed more oil, you would add to it. If you needed more oil while you were sharpening, you would then add to it. And oil allows for the increased ease of sharpening. It allows the instrument to move over the stone, so it's decreasing friction, and it also helps to cover the pores in the stone so that they're not going to clog with the metal filings from the instrument. I will keep this particular gauze square right here at the edge of the cassette and use it again if I need to lubricate further. If I were using the ceramic stone, I would simply take the air water syringe and I would just lubricate that with water and then again rub the water into that stone with the gauze square. So the Arkansas stone is now lubricated. I use my patient treatments and overs to obtain the oil, to place the drops, and then I put the oil away. To spread the oil, strictly patient treatment gloves at this point because I'm touching the cassette. So what I want to do at this point is determine whether my instrument needs to be sharpened or not. So the plastic test stick that's in your kit, some of them are clear, some of them are blue. You may find them to be different colors, but that's clipped underneath the clip in the test stick, in the cassette rather. So what I would do at this point is I would take my test stick and I would also take a piece of gauze and wet it. Roll it up and place it under the clip where the test stick was. What I want to do with that is to wipe sludge from the instrument. And what sludge is, it's a byproduct of the stone, the oil, and the metal filings on the instrument. So I would wipe the sludge onto that dampened gauze square prior to reintroducing the instrument into the patient's mouth. So I have everything set up that I need at this point, and I'm going to begin with my SH67 scaler. So what I have to think about is how many cutting edges it has per working end, and we know that we've identified this to have 2 cutting edges, 2 usable cutting edges per working end, so I would have 4 per instrument with this particular SH67. So using a bit of a modified pen grasp, what I typically will do is place my middle finger on the top of the test stick and test the instrument from heel, mid, to tip third. And I just want to feel it grab the stick to determine if it's sharp or not. So heel, mid, tip third, rotate to the opposite side, heel, mid, and tip third, and then I would also repeat that same process with the other end. I'm angulating into the test stick as if I were debriding on the tooth, so that I'm going into that 60 to 80 degree angulation to actually have that test stick grab the stone. I want to make sure that the cutting edge is properly adapted. I'm not trying to debride the stick, I'm just trying to grab that cutting edge. A dull edge is going to reflect light because I will have there more of a surface, but a sharp edge does not reflect light. So that's another way to determine if you need to sharpen your instrument. The most effective for you right now will be the utilization of that test stick, all right? So you want to hear it, catching, catching, catching. Same thing on the other side. This instrument is very dull and needs to be sharpened. Okay. So I've tested my instrument, and I'm going to typically, as you become more adept with this, you will determine, do I need a light to a moderate pressure for sharpening? This one I would use a moderate pressure, but right now you're going to all use light pressure and then have to repeat the number of strokes as needed until you begin to become more comfortable with finding those cutting edges. So what I would do is place the instrument. I would adjust my light so that it's right over the stone. I also place the stone at an angle on my cassette so that I can see the face and the cutting edge of the instrument a little bit more clearly. So I've angled the stone up onto the edge of the cassette, and I'm going to use a technique called stationary stone moving instrument. So by that I mean, with my non-dominant hand, I'm going to hold the sharpening stone in position with my index finger and my thumb, and I'm going to place the instrument down, and I'm going to move the instrument versus the stone to sharpen it. So I will place the instrument down on the stone so that the cutting edge and the face of the instrument are at a 90-degree angle to the stone. So what does that mean? When I take my probe and just show you how that face would extend upward, see how this would come up in that plane? This inner angle right here is 90 degrees. Okay, so what I'm doing is I'm placing the working end flat down onto the stone at 90 degrees from the face of the instrument to the stone for that inner angle. The other concept that I'm thinking about is that the working end remains parallel with the bottom of the stone. 90 degrees, and then I'm going to flatten my grasp out on the stone, and I'm going to rock up to 110 degrees, so just a small rock upward. I'm going to place the heel of the stone, my weight on the heel of the stone, and I'm gently going to, using light pressure, pull back straight towards me 3 times on the heel. So 1, 2, 3. I'm going to move to the middle of the stone, back to 90 degrees, rock up to 110, 1, 2, 3, to the tip of the stone, again shifting over on the stone, holding the stone stationary, rock up on the tip, 1, 2, 3 strokes. I'm then going to turn the instrument over because remember I have 2 usable cutting edges there. Place it again at 90 degrees, rock up to 110, and begin with the heel, 1, 2, 3, over to the mid portion, rock up to 110, 1, 2, 3, over to the tip of the instrument, shifting along the stone, place it at 90, pressure towards the tip, and 1, 2, 3 strokes. Then I'm going to take the instrument and I'm going to do something called hone the face. I'm going to move the face of the instrument over the stone a few times at the more narrow end to remove any wire edges or burrs that may have been created during sharpening. It's called honing the face of the instrument. So some things to think about as you're sharpening. Definitely keep your stone stable, and as you noticed when I'm sharpening, I'm pulling my arm straight back as I move. I'm not making any other adjustment to it, so it's just using kind of a flat fulcrum, pulling straight back, supporting myself along that stone as I come back. And with this, remember I mentioned that I could use a moderate pressure with this, but as you're introducing yourselves to sharpening, you would go with a lighter pressure and then wipe off the sludge once you're done, because we're getting ready to reintroduce this into the patient's mouth. So wipe the instrument itself off onto that gauze square, and then taking your test stick, you would reassess to determine if you were effective with your sharpening technique. So I will place the heel, grabbing, mid, tip. Definitely better. You can hear the sound and you can see that grabbing, and I would also check the other side as well that I sharpened. Heel, mid, tip. Improving. I would sharpen that again. Okay, I would continue until I got to the point where it reached its maximum effective sharpening point. Okay. So then I would also do the other end the exact same way, test it, ensure that I was ready to move into the oral cavity with it. Curettes are going to be slightly different, because what do we know about scalers? We know that they're triangular in cross-section with a pointed back. So if you notice, there was no rocking up, there was just a straight motion coming back towards the operator with your sharpening stroke. With the curette, I would test it exactly the same way, except with curettes, I know that I'm looking for lower edges. So I want to make sure that I found the correct edge so that I'm not sharpening the opposite side. So I would test heel, mid, toe third, the other end, heel, mid, toe third. So nothing is grabbing into the test stick at that point, so I know this is very dull. But again, I'm going to use a light pressure. You notice with the scaler that you're working your way across the stone as you're sharpening, and that's because you don't want to sharpen everything in the same spot on a stone, or you'll wear the stone down, so you'll decrease its the life expectancy of the stone. So I'll place the curette down, again at 90 degrees, so that the face of the instrument is at a 90-degree angle to the stone and that the working end is parallel with the bottom of the stone, and I'm going to use a stroke that covers the entire stone when I'm sharpening. So 90 degrees up to 110, and I'm going to pull back 3 times. 1, 2, 3, and on the third stroke, I'm going to rock up to keep the semicircular cross-section rounded. Okay, I want to keep the back of that curette rounded. So again, I'm going to place now the mid-third as I'm shifting across the stone, rock up 90 to 110, 1, 2, 3, and rock up on that end third. And then the toe third, I would shift over on the stone, shift my weight and pressure to the toe third, and lightly rock up from 90 to 110, and 1, 2, 3, and rock up on that end third. So you're pulling back, and then at the end it's a rock up on that last third stroke. I have a toe on this instrument, so what I want to also make sure that I'm doing is keeping the end of that toe rounded. So what I would do is then place the instrument down. This is the final stroke. Roll up and over the end of the toe and drag it back. So place the instrument straight down, pull back, roll up and over the end of the toe, and bring the instrument straight back. When I'm done, I would then hone the face of the instrument to remove any wire edges or burrs that I may have created during sharpening. I would remove the sludge on my wet gauze, and then I would reassess to determine if I was effective. Definitely you can hear that that is definitely grabbing that test stick, so I know that I am approaching a sharper instrument, but I would do this again to attain maximum sharpness. Okay? When I move to the posterior instruments, the EXD, the SG1112 would be exactly the same thing. You would put that down, again, working end parallel with the bottom of the stone, 90 degrees up to 110, and then do the exact same stroke. So all curettes, you're pulling back 1, 2, rocking up on the third with each particular sequence there, and then rounding up and over on that toe, and then honing the face of the instrument. As you get to the Gracie 1314, you have to make some slight adjustments to sharpening in order to have the cutting edge actually contact the sharpening stone properly. So what you're going to do with that is, using the more rounded end, the higher side, you're going to place the proper working end, the lower cutting edge of that Gracie 1314, off to one side of the stone. So I would adapt my cutting edge, and I would make sure that my working end is parallel with the bottom of the stone, but I have to offset my handle slightly on the stone because the cutting edge of this instrument is already adapted to the stone. If I were to rock up to 110 like I did with the others, I would be on the lateral surface of the instrument. So I'm going to remain down, and in a single area, I'm going to come up 3 times on the heel, rocking up on the third. I'll reposition again in the exact same area, shift my weight to the middle of the instrument, rocking down and offsetting the handle, making sure the working end is parallel with the bottom of the stone. I'm not going to rock up at all. I'm going to just come back 1, 2, 3 times, rocking up. And then the toe, the exact same thing in the exact same position, because I need to keep my shank off the stone in order for me to contact that cutting edge properly. So toe, 1, 2, rocking up on the third. Then I'm going to roll up and over for that last stroke on the toe itself. When I'm done, I would hone the face again to remove any wire edges or burrs, 3 or 4 times there, remove the sludge onto the damp gauze square, and then I would reassess to see how effective I was with my sharpening technique. Okay? And I would do the same thing with the other end. The other instrument that you have to think the same way about in terms of offsetting the handle is the SD204. So that's your posterior scaler. So we know that that has 2 usable cutting edges, correct? So one end of that, again, I would test it. I would test all the heel, the mid, the tip, the heel, the mid, the tip, flip it over, test the 2 usables on the other end, leaning into it, heel, mid, tip, heel, mid, tip, and you can hear some of those are sharper than others, but they need to be sharpened. Everything needs to be sharpened uniformly, so you wouldn't just sharpen a tip or toe third and then not a heel or a mid third, and we'll discuss that in just a minute. So when I go to sharpen this instrument, the end where the bow is down towards the sharpening stone, I would just sharpen as I typically did with all the other instruments. Place it the face at 90 degrees, rock up to 110, and then 1, 2, 3 on the heel. Shift over, I'm at 90, up to 110, 1, 2, 3 on the mid. Shift over, 90 to 110, 1, 2, 3 on the tip. When I sharpen the opposite side of it, where the bow comes up off the stone, just like the 1314 did, I will sharpen it exactly like I did the 1314. So everything will happen in this one area. So I would stay down on it, offset the handle so it's coming this way, it's not straight over the stone, and the working end would be aligned parallel with the bottom of the stone. Stabilize the stone, and then I would do 1, 2, 3 heel, same area, 1, 2, 3 mid, and the same area, 1, 2, 3 tip. Right? It's a scalar, so I'm not rocking up. When I flipped over to do the opposite end, I would turn the stone over again so that I had the higher portion over here, and I would repeat. The side where the bow was up off the tooth, the shank was up off the sharpening stone, I would repeat exactly that same way, everything there, but the other side of it would be a typical sharpening sequence where I would use the heel, the mid, and the tip third. So when you think about your rationale for sharpening, we know the instruments are going to get dull, and so you want to maintain their integrity. You want to maintain the integrity of an instrument, you want to maintain the contour of an instrument, and you want to increase the life expectancy of an instrument. You also sharpen for ease of debridement. If the instrument is sharper, obviously you're going to be more effective with debriding. It decreases operator fatigue, it increases patient comfort, it decreases burnishing of calculus on the tooth and gouging of the cementum. So cementum can be gouged where you're actually taking out microscopic pieces of cementum with a dull instrument. So you want to ensure that you're familiar with your rationale for sharpening, and you also want to remember that when you're done sharpening, you've tested everything, you've ensured maximum sharpness, that the actual stone itself must now be cared for. So I would take a wet gauze and I would remove all the sludge from that stone, front, back, sides. Remember, we use the sides for honing. And I would ensure that this is going into the instrument maintenance system for ultrasonicking and then autoclaving so that the pores are clear of that sludge to allow that autoclaving process to be more effective and, again, to increase the lifespan of the sharpening stone.